Hi, my name's Megan, and I'm a somatic practitioner. I help people heal and recover from trauma. And today I wanted to talk a little bit about what trauma is. And I think it's really useful and important to know what trauma is if you're going to heal from trauma, but also just if you're a person who lives in the world, it might be good to know because trauma is a pretty big deal in our world right now. So, when I first started learning about like somatic therapy and trauma healing, I had to really like rework my definition of what trauma was because I used to be really annoyed with the word trauma, honestly. Whenever I heard it, I would kind of roll my eyes. And what I've learned over the years is that my old definition, the reason I was rolling my eyes is because I was like working off an old definition of what it was, you know. So my definition used to be that it was trauma if it was like a really kind of narrow and specific category of like really intense things, like if you went to war, then you could have trauma, or if you were in like a really bad accident, then you could have trauma. And I had a pretty big misunderstanding about what trauma was. And in the last maybe 20 years or so, there's been a lot of research on what trauma is and how we heal from it, etc. And that research has sort of redefined what trauma is. So the definition that's more updated is that trauma is really not about the event, but it's about how the event affects you. Right? So trauma is anything that happens to a person that is too overwhelming for them to like process the thing that happened, to metabolize it. So it's a really personal definition, right? For some people, something will be traumatic, meaning it will be too overwhelming for their system to process. And it will, because they can't process it, it will stay kind of stuck in their system. Right? So for another person, that same exact thing could not be too overwhelming to process. And so they could be able to process the thing and metabolize the thing, and then it would not stay stuck in their system. And so then for that person, it would not be trauma. So it could be the same event or the same series of events, but it's really about how it lands inside the person. And is the person able to metabolize the event or the series of events? And, because we're mammals, because we're animals, we're biological creatures, we need actually to have certain things in place in order to metabolize an event or a series of events. And by metabolize, I mean, process, right? We have to process things as humans. We have to, just like digesting food, we have to digest our experiences, we have to take them in, we have to make meaning from them, we have to discern what is useful in that, what is not useful in that, we have to let go of the old pain, right? There's a whole like process that we go through as life is sort of happening to us, where we're like digesting life, or we're not, right? And when we can't digest it, that's trauma. So it's a very personal thing, and it will really vary from person to person. But, let's say something happens to somebody, there's an event, and they are able to process it, they are able to digest it. That would mean that they had a couple things in place. They had safety, they had their body, not just their mind, but their body felt safe enough to process and digest the event. And within that safety, we need to find a sense of connection, right? Because again, this is just like human biology. Humans need to feel in connection with each other, with themselves, with the earth. We're relational beings. That's how we're wired, like literally in our biology. So if we don't have a sense of being connected to anything or anyone, and or we don't feel safe in our bodies, we don't perceive safety, then we're not going to be able to digest the thing. If we do have the safety and we do have the connection, then we are going to be able to digest the thing. So the undigested thing is trauma. And I want to also just further clarify. So we've got this idea that the undigested thing is trauma, and it's undigested, right? So it just is kind of like sitting in the person. It's stuck in there because it's not been able to be digested. And that kind of stuck energy, you could call it energy, right? That stuck energy is going to cause problems for the person. And the list is really long of what kind of problems it could cause. It could cause anxiety. It could cause depression, chronic pain, chronic illness, trouble with intimate relationships, insomnia, sleep problems. I mean, it's a really long list. Addiction, right? There's so many things that this stuck energy could cause. Some kind of problem, basically, right? And so the problem, the addiction or the anxiety, is not the trauma. It's the symptom of the trauma that's stuck, the energy that's stuck, that hasn't been able to move. So there's a couple different kinds of trauma that we experience. One is called shock trauma, and that's maybe the one that you might think of more normally when you think of trauma. And that's like usually just like a one-time event that happens to a person and it shocks them. So an example is a car accident, right? It's just shocking. It's like, oh my God, that just happened, right? Yeah, there's lots of different kinds of shock trauma, but it's just like a one-time event that happens. It can be an accident. It could be getting assaulted or getting mugged. I mean, it could be a lot of things, but it's a one-time event. And then there's another kind of trauma that's kind of ongoing. And this is called relational trauma usually because it happens in a relationship, usually. So this kind of ongoing trauma that happens in a relationship, relational trauma, is some kind of relationship dynamic that the person is not able to get away from. Adults can have relational trauma, certainly. But oftentimes relational trauma happens to children because children are not able to leave or protect themselves in a toxic relationship, right? If they're in a relationship with a toxic person, they don't have any control over that, right? Versus an adult, adults can have relational trauma too, but it's just less common because oftentimes adults have the ability to leave the relationship or to change the dynamic or somehow protect themselves. They have a lot more power. But children, are pretty powerless and pretty just subject to whatever relationships they have or they don't have. And so that when relational trauma happens to a child, it's called developmental trauma, right? Because it's happening while the child is developing. Now, there's other kinds of trauma too. I mean, there's tons of kinds of trauma. There's so many kinds, and different people use different names for the same kind. It's very confusing. I'm just going to keep it at this for today. I do want to talk a little bit more about developmental trauma because it's incredibly prevalent. It's incredibly prevalent. Some people estimate that it's like 60 to 100% of the population has developmental trauma nowadays, which is huge. And, I just was talking about being stuck in a relationship with a toxic person. And that can definitely happen with developmental trauma where a child is, basically stuck with their caregivers who are treating them badly somehow. We think of the classic thing of child abuse, right? I mean, it's very traumatic for the child. But then there's also a kind of developmental trauma that is, I think, much more prevalent where the parents are not doing anything overtly messed up, and the parents are really usually very well-meaning and very care very deeply about their children. And yet this developmental trauma can happen and usually does, honestly, because of the way our society is structured. you know, there's a lot of research, and a woman who does this research who I'm totally into her work. Her name's Darsha Narvaez, and she's a PhD psychology, research psychologist, and she studies like what do children need to develop properly. And I'm talking about what they need on like a biological level, not, what parenting style do we think is cooler, or, like there can be a lot of debate about that in society nowadays, but actually like just what does their biology say that they need? What do children need? What do humans need when they're developing? So, first of all, let's acknowledge that the developmental period for a child, for a human, is very long, right? Children develop so much of themselves outside of the womb. We know that the brain doesn't fully develop until the person's like 25 years old, right? I mean, that's just one example. So it's like a very slow, long process where there's a lot of vulnerability developmentally in that process. Humans are complicated, right? It takes us a long time to develop. So a lot can go wrong in that time. And there's a lot of things that children, teenagers, adolescents, even people in their early 20s, there's a lot of things that they need to be well from a biological standpoint. And, you can look up Darsha Narvaez's work. There's a lot there. I'm not going to go into all of it, but like one of the things that they need, for example, is a community of care. So they actually need to have, some of the estimates are like 30 caregivers, like 30 adults who are available for them as caregivers. That is a huge number. And some of the lower numbers, some of the lower estimates are huge as well, right? So we could think about like 10, even 10 would be huge, right? And so this is like 10, 20, 30 adults who are available for that child. And the idea with that is that if the child needs something, which they almost always do, that there's a safe, loving adult available for that child. And in our modern kind of nuclear families, we have maybe one or two people, available for the child, which is just, it's too much. It's too much for one or two people. There's no way that they can meet all the demands. So there's going to be times where the child is not able to be fully met by their mom or their dad or whoever their person is, because that person has other stuff they're dealing with or is trying to take care of multiple children or whatever, right? And so just that in and of itself actually can be a trauma for the child and is not the parent's fault. It's the way our society is structured. And this obviously structure has been going on for a long time, right? And this is traumatic, just that. And there's other things about our structure too, our societal structure, that really create trauma for children. And it's not the parent's fault, right? I want to be so clear. It's not the parent's fault. This is just how our society is structured. So what happens is that these children are not getting their needs met, right? They're not getting their needs met. And children have a huge amount of needs, not because they're bad, but just because that's human biology. We're kind of high maintenance creatures. We just are. We need a lot of things. We need, to be nested in communal care from the time we're born until we're, really our whole lives, but like, especially through our whole development. And we need other things as well. We need we need multiple people to really attune to us, which means to really take the time to get to know us on a deep level. We need to be validated and affirmed. We need to have people who are willing to like mentor us and draw out our talents. We have huge, massive like nutritional needs. We have so many needs, and our society is not set up in a way that those are provided for children. So we all maybe, or most of us have some form of developmental trauma just from that, right? Just from that. And then you add in, other layers of maybe having a caregiver who has mental health problems, or maybe having a caregiver who's struggling with addiction, or having a caregiver who didn't get what they need as a child, so they just don't know how to give it, right? So it's a big deal, right? And just along those lines, we've kind of covered a few things about what trauma is and focused a little bit more heavily on developmental trauma. But the truth is that a lot of us have developmental trauma, and we have some shock trauma from the different experiences we've had in life. And for a lot of us, we don't have, or didn't have, the safety and the connection needed to process that. So it's still just kind of sitting in there with us, undigested, right? So in my next video, I'm going to go into more about how we can digest this undigested material that's like causing us problems. Earlier I called it energy, now I'm calling it material, but there are ways to heal, and that's the good news. Science has done so much work recently to help us learn about how trauma heals, and it really does heal. The body actually knows how to heal it, just in the same way the body knows how to heal a cut. But if you cut yourself, you might need some things to facilitate the healing. You might need the right environment. So maybe that's a Band-Aid, or maybe that's some cream, some antibacterial cream, or, maybe you have to keep it clean for a while, right? You have to kind of create some conditions, and then the body will heal the cut. And it's kind of the same thing with trauma, that when we create the conditions, the body can heal it. And this is what science has been uncovering in the past, again, few decades, is that there is this way, and it is possible, and it does happen. And I know that from personal experience, as well as from what the science is telling us. And of course, the science is validating what indigenous cultures have known for a long time, right? So there's a lot of ways that indigenous cultures have already known how to create those conditions. But a lot of that knowledge has been lost, through the years. And so the science that we're finding now is kind of bringing some of that back and validating some of that. And then there's also stuff that the science is discovering that's maybe not so reflected in the indigenous wisdoms that we know about. So it's also bringing new things to the table as well. So we're in this really cool time in history now where we have so much opportunity to heal because we know how to do it. And this is, it's been a long time since this knowledge has been so available, right? And it's really cool. And, I'm sure you know that we're seeing a lot of pain in the world right now, a lot of suffering, a lot of hurt. And a lot of this is because so many of us have this undigested energy inside this trauma. And so it's such an important time for us to start doing this work of digesting this stuff, right? And when we do this work, we experience so much benefit personally, and it also goes out into the collective. It ripples out. So I'll stop there. That was a lot. Thank you for taking the time to listen and to learn about this. I know it can be kind of heavy subject matter, but it's so important. It's so important. So good for you for listening. Thank you. And more next time. Bye.